Father Bryan, thank you for joining me here.
Absolutely.
I maybe just want to start a little bit with people may not know who you are and what you do. So could you maybe just share a little bit about your state in the world and what you do with your life?
It's a good questions. Yeah, I'm not even sure what I do most of the time.
Me
Yeah,
too.
no, glad to be with you. Very grateful for the invitation. So I'm a priest of the Archdiocese of Vancouver up here in Canada. And my priesthood kind of took a bit of an unexpected turn. Very early on, my bishop asked me to study psychology. So a few years after ordination, with no background at all in the field.
Oh,
Uh,
interesting.
yeah, it was kind of a real unexpected new opportunity and challenge for sure.
Mm.
So I was vocations director, and then we were having trouble finding, all candidates for seminary now need a psychological evaluation. So that was kind of the proximate impetus to explore this. But my previous bishop was a real proponent of academic pursuits, and so very supportive and encouraging. So he sent me for my doctorate in clinical psychology, which I completed in 2021. And I have been back in Vancouver since then, serving as a priest, but serving primarily from that perspective of offering psychological services. So
Yeah.
I'm a licensed psychologist. In Canada, we say registered.
Okay.
And so I provide a number of psychological services largely for the clergy and seminarians, a lot of the pre-seminary or pre-religious assessments, and then some ongoing work with primarily with guys in the seminary. That's sort of the main focus.
Yeah.
And I get to do a little bit of teaching as well, which I really enjoy.
Yeah, yeah. Oh, that's very cool. Yeah, so I maybe just a few caveats for people who are listening that I just want to share. I don't know how familiar with the stuff that I do, but I have a wide range of people who follow my stuff. I have people who consider themselves like very Orthodox Catholics, including like LGBTQ people who want to live a traditional Christian sexual ethic. And then I have like deconstructed people or people going through deconstruction who are kind of reimagining how they want to relate to their Christianity. And then I also have this like group of like people who identify as ex-Catholics that think maybe not everything, but a lot of things the church has to say about sex and sexuality is bad, but they're still interested in these conversations. I do maybe just want to, as a caveat to this conversation, you're a Catholic priest. You have certain like obligations, values, and commitments that flow from that. For the purposes of this conversation, we're going to kind of operate within that world. So I'll say, for the people who are more on I want to live a committed Catholic life in accord with Catholic teaching, this will probably be more catered towards the world that they're in. And then people who are on the other side, I hope this is at least interesting. But I want to start with a question about, not a lot of priests go through the psychological training. You said you were a director of vocations prior to getting your doctorate. I would actually be really curious to hear from you. Did studying psychology change the way that you showed up in your ministry outside of just psychological practice, outside of just psychological practice?
For sure. Yeah, that's a great question, and absolutely true. I just want to respond to your caveat first, I've been following your work for a while, and very grateful for your voice in this space. I'm very happy to be with you, and looking forward to this conversation. And I hope that I have a real heart for people who've been hurt by the church, people who have been who've experienced in some ways kind of the church at her worst. And the way in which, particularly a lot of conversation around sexuality has been happening is extremely painful and unhelpful. And I, from a psychological perspective, would say unhealthy in some contexts, in some ways of approaching it. And so I just, again, very grateful for your voice, Chris, and those like you. And I want to hopefully, be able to speak to some of those, some of your listeners who would have had experiences like that or continue to experience that. And, it's definitely been an area kind of newfound exploration and understanding for me as well, kind of alongside this this work in psychology with seminarians and those in formation. In terms of, what's kind of shifted for me with psychological, kind of bringing a psychological perspective into ministry, I would say that a lot of it dovetails with a lot of the emphasis of Pope Francis's papacy. It's just like this radical posture of listening. The word accompaniment is thrown around a lot, but it's really a question, and you said it, Chris, is like, how do you show up? That's a great question. How do you show up in these various settings, various conversations, and what is not just like the quality of your presence, but the posture that you bring to the people that you're interacting with. That has been a real area of shifting for me. A good colleague and I think a mutual friend, Dr. Julia Sadusky, has contributed so much to this conversation, which I'm very grateful for her work. And she often talks about, or she helped me to look at like what comes up first in these interactions. Like, where do your thoughts or where does the conversation go to first? And I think that's an area that we can do more as a church, is because so often, especially in conversations around sexuality and morality, we have a lot of voices who will immediately begin with the truth, or quote unquote the truth. And it's like, maybe hopefully there's space for that part of the conversation, but so often what is needed, what is being even like an unspoken desire for the other in the conversation is to be received, to be seen, to be listened to in a deep way. Like, do you actually care about me? Do you want to know me? Are you interested in hearing the struggles and the journey, that have brought me to this place and that have been part of my journey of faith? Like, what the kind of presence that I can offer, in those spaces has really shifted a lot for me in recent years.
Yeah, it makes me think of my relationship with one of my best friends who's a therapist. And early in our relationship, when she would express emotions to me, my tendency was always to want to jump in and fix it, address the problem. What can we do to change the situation that made you feel this way? And she really had to push on me. And after a while, she was kind of like, you have to stop. If we're going to be friends, you need to understand that when I'm expressing these things, sometimes all that I want is just say it and to feel like you heard what I was saying. I don't want anything to be fixed. And there are times when I'm like, no, I think that we need to talk about how to change the situation. And now we'll do this thing where I'll say, is this a listening conversation or a fixing conversation?
That's great.
And sometimes, and we usually have to do the listening first before we can focus on the fixing, which is, I think, very consistent with what you're sharing here, is just that listening posture. Sometimes it's all that's needed, but certainly it's always what's needed first. So, I'd be really curious to hear from you. So, and you currently practice as a psychologist, is that right?
That's right.
Okay. And are most of your clients pre-seminarians? What does your client list look like generally?
Yeah, most of my work is directly for the church. So I offer counseling and these psychological assessments as well for seminarians, candidates for seminary. And then I do also offer counseling for members of the clergy and religious orders. And then it's kind of complicated, but through a private practice, a partnership with a local clinic, they provide some space, and I also will see some clients, very, very small number of clients through their clinic as well. Mostly, I would say, in terms of the balance of my work, I would say it's like roughly a third seeing clients in counseling or therapy, a third doing these assessments, and then a third kind of teaching or general formation.
Okay. Yeah. That makes sense. It's really interesting. Yeah. One of the things that you mentioned earlier was, harmful or unhelpful messages, rhetoric, frameworks around sexuality that kind of circulate within the church. Could you share a little bit about how you would how you characterize some of those and kind of what your response would be to them now?
I would say, within the field of psychology, there's quite a diversity. And I am very drawn to what's kind of generally known as depth psychology or psychodynamic approaches to psychotherapy. And the general idea is that you've probably seen the iceberg metaphor, where 10% is above the surface and 90% is below the surface. Mm-hmm. And I believe that that's true. I think, in terms of our conscious awareness of our experience and our behaviors and why, our motivations, very little is actually at the conscious level. It takes a lot of work to bring to consciousness, these sort of hidden dynamics that are at work all the time in every interaction. And every experience. So on the topic of sexuality, I would say one thing that's very unhelpful is a fixation on behavior. Speaking of kind of a solution focus, like with your friend, which is a great example, so often, so much of the conversation around sexuality is about changing behavior. And, that's often, sometimes a really important part, especially if there's harmful patterns of behavior or things that are really impacting one's life, that's real. And I don't mean to minimize that at all. But I think we rush sometimes much too quickly to, okay, let's change the behavior without time for, let's explore that. What's happening? What's underneath that? And what might we not be aware of yet and might need to hold space for, to allow to emerge and in a kind of open-handed, very patient posture that there's no urgency. There's a false sense of urgency sometimes that comes in that is also very, very unhelpful. Because the real work of growth and change and maturation, whether that's psychologically or spiritually, that is slow, patient, lifelong work that is never finished. And I think sometimes we present this idea that we're supposed to be finished very quickly, like tomorrow, and you have it all together. And it's like, oh, that'd be nice, but that's not how human beings work.
Yeah. Yeah, I'm really curious how you would approach this with priests and seminarians specifically, right? Because I think for them, there often can be this sense of urgency around, I have to live out the obligations of chastity within the context of this vocation, right? It's a requirement, it's a necessity. It's how I want to live my life. So, given your focus in depth psychology and your, work with them, how do you help them when they may be struggling with that commitment and they feel that urgency, which is also a real part of their calling?
Yeah, I think that's the crux of a lot of the tensions in this, particularly in the work with seminarians in formation is how to be helpful. And I think, so one thing I'll say is that I'm very encouraged by a real openness in most seminaries that I've encountered and seminary faculty. There does seem to be a growing openness and awareness of a much more psychologically minded approach to these questions. And there's some great work being done across the United States and in Canada, where there is more space being created for some of these deeper questions and less kind of this urgency of you need to fit these rigid categories, at certain stages of formation. Yeah. Because often those categories are very externally based. They're very focused on behaviors and external kind of measurable outcomes, which have a place, of course. And there's certain behaviors that, okay, if this is part of your life in seminary, it's probably a sign that at least not yet, readiness for ordination. But there's a whole range of experiences with sexuality and wrestling with the call to celibacy, and living out chastity that, it takes a lifetime to develop. And so I often find myself saying things like, while working with like formation teams in seminaries, there can be sometimes some real anxiety around this. Like, oh, is this guy ready, or is this behavior problematic? And a lot of that comes from a place of care, of wanting to help the church and wanting to help the candidate to come to a healthier place. But sometimes, and we have to be very aware of this, is like, might it also be our own anxiety? That I can feel like I've done my due diligence, like I've given the tools, needed or whatever. Yeah. And so I often will say things like, can
it's
we
like
help?
Parents.
Exactly. Yeah, totally. Yeah. So can we help somebody be on a trajectory rather than seeing these kind of rigid sets of categories and observed behaviors? Like, how can we help a guy or a candidate for religious life, man or woman, come to a place where they're on a path, and there's a deepening openness to exploring the reality of sexuality and their experience, and they're sort of set on a path that sets them up for success in the best possible way, rather than being adhering to sort of like these rigid categories of, did somebody, have a struggle or not? Or, like what's the frequency? And we kind of tie ourselves in knots about this.
Yeah. So I don't think it'd be surprising that I'm going to ask you about like same-sex attraction and how it shows up in these spaces. But I would be really curious just to hear kind of generally, or you can share as specifically as you'd like, what are some things that you have found to be helpful or unhelpful when you or seminaries or formators or religious leaders are working with men who want to become priests and experience same-sex attraction or might identify as like gay or bisexual?
Yeah, that's not surprising. It's a good, a really good topic, and something we need to talk about more. And something that's very difficult to talk about in the church. There's just been a lot of history and a lot of pain there. So again, it's more a question of like where to begin. Oh, there's so much. I was watching an interview, and I'll try not to name specifics here, but I saw an interview, I think a podcast, with a prominent Catholic cleric who was interviewing a gay man. And I just saw the clip, so I don't know what the full interview was like, but the cleric said, I wouldn't want you to leave this conversation with the only thing having heard that the experience of homosexuality is intrinsically disordered. That's the first thing he said. And going back to, what our friend Julia has said, like, that's the first thing? That's the first thing you say? Really? Like, my God,
It makes me think of, I had a friend who was a transfer student at my college, and on transfer orientation, the president of the college said, first thing I want you to know is that you are just as much a student here as everyone else. And what all the transfer students took away from that is we are not the same as everyone else.
Exactly.
Yeah.
There's kind of an implied negation there that actually suggests the opposite, right? It's like, oh gosh, we do this all the time. So, I would say that I'm very grateful for, there has been a lot of movement in this area, the area of same-sex sexuality in the church, a lot of really tremendous voices, your own, of course, and Eve Tushnet I find to be a really helpful perspective. Her book, Tenderness, somebody summarized it as like, I know, it's amazing, right? Just so beautiful.
Yeah.
And somebody kind of jokingly summarized her book as "Gay people exist. Chill out."
Yeah.
It's like, it's real.
Yeah.
So it's more, okay, how are we responding? And I think too often and for a long time, the response has been to try and categorize and define and put into familiar categories. That it still kind of mystifies me a little bit, the how widespread the language of sexual orientation change efforts, or commonly called conversion therapy, how widespread that's taken root in a lot of Catholics, particularly mental health voices. And I'm a little suspicious as a healthcare professional, and with a little bit of a foot in academia, a little suspicious of a branch of the field that is really only found in religious circles. It just raises questions of like, is this objectively a scientific approach, or is there something else that's kind of driving it? Again, I'm not an expert in these things, but it just raises questions for sure. And so I think what has been really helpful for me is in this kind of posture of listening and of just trying to learn, is like, can we learn something about the LGBTQ experience? Yeah. Can we learn about the experience of psychosexual development for a same-sex attracted person, growing up in a conservative religious environment? Like, what can we learn about that experience, and how can we better respond? There's so much to learn, and it discourages me, and it disappoints me and it makes me angry sometimes when there are these kind of reactive voices that sort of impulsively reject that which is different or unfamiliar or doesn't neatly fit into these previously existing categories, and just kind of a pushing away.
I would be really curious to hear from you. I mean, so you work with like priests, seminarians, religious. I am assuming some of them come to you and they're dealing with they experience same-sex attraction, or their experience is somewhere in that area, and they're having to process harmful messages they received about same-sex attraction within the church later on. I would be curious to you, what do you want Catholic leaders to know about the challenges that they face because of harmful messages they got in the church? And what would you want them to know in order to do better, or to be more helpful for their long-term commitment to their vocation to celibacy, to chastity?
That's a great question, and helpful to bring me back to your previous question. What is actually helpful? Sorry, a little off track. One of like the fundamental markers of mental health, but also just of spiritual health and maturity, is self-acceptance. And to be able to look at oneself in the mirror and kind of take in the whole of who I am and my experience, my history and my current experience, including sexuality, to be able to take all of that in and to love myself in that. That is like the foundation of everything else. And it's also a very difficult and lifelong journey. And so, in terms of working with, clients of any kind who are wrestling with sexuality, or same-sex sexuality in particular, that is often a huge area of focus, is self-acceptance and self-love And like even this is particularly important for individuals with same-sex attraction, however they identify, LGBTQ or whatever labels they prefer, that there is an appreciation for the beauty of sexuality. Because that is so often like the exact opposite of the messages that are received, especially for LGBTQ individuals, is that they're sort of, well, yeah, I won't even say it. Your listeners know the language that's used. It's so painful and so rejecting and just laden with shame.
Yeah,
and so a lot of the journey of whether it's for seminarians or anyone, a lot of the journey is undoing some of those harmful messages, self-rejecting messages and communally rejecting messages, and coming to this place of like, oh, actually, I see myself, and I see all of myself, and I see something beautiful, and I see, and I delight, and then I experience also something of God's delight in me. So in terms of what, I would love to see more of in the institutional church, and I think we are seeing some movement, is a recognition of that, and a giving a voice to that at more public and institutional levels. I think we don't, sitting down and hearing the story of particularly gay Catholics and the explicit, because it does happen explicitly, these messages of rejection, and implicit. There's so much implicit, even just by the absence. Like, look around the community, there's no one else, it appears, to share my experience. It's profoundly isolating.
I think back to an experience I had when I was in graduate school, and my parish asked me to give a talk because I was getting my master's in Catholic Studies. And at first we were just talking about maybe economics and Catholicism, but I was also doing speaking on what the church has to say about like same-sex attraction, homosexuality, based partly in my experience. And I proposed that to my pastor, and my pastor said, well, our parish isn't ready for that. And my takeaway from that was just like, my parish isn't ready for me. And then looking back on it now, I think at this stage of my life, I would just raise the question, well, then why would I listen to anything that you have to say about my experience? If you're not ready to have a conversation about it, like, why would I consider you an authoritative figure when it comes to commenting on my experience?
Right.
Yeah.
Right. Which is a place of maturity for you to arrive at, to be able to be able to navigate that, but also like profoundly rejecting, that we're not ready for you. That's hardly even implied. That's somewhat explicit, and sadly, probably not untrue. It was like it's sort of, there's a lack of readiness, in a lot of communities to engage in a meaningful way with some of these conversations.
I just maybe to kind of go in a slightly different direction. One of the things that I'm always interested in when, Catholic therapists, psychologists work with LGBTQ people, and there's kind of a faith component in the work. How do you parse out the boundaries, the professional ethics, the roles and responsibilities of the licensed or registered mental health professional, alongside your own views, commitments, obligations as a Catholic, and especially as a Catholic priest?
Yeah, it's a really important area to navigate well, and I think different Catholic therapists, may take different approaches, but all of us are really, should be wrestling with the ethical guidelines and boundaries in this field, because a therapist occupies an enormous place of trust in a person's life. And we have these very robust ethical guidelines precisely because of that, because of the significant influence that we can have in someone's life for good or for ill, sadly, sometimes. And so I think I know that that different therapists will approach it in different ways, and there are different ways of kind of resolving those ethical conflicts. It is. I have not really experienced what some Catholic therapists have reported experiencing, kind of some discomfort with their professional organizations or things like that. If there's, people use different language, but, if there's an agenda or kind of feeling sort of unwelcome in the professional associations, I've not really experienced that. That's not been my experience. I've found the psychologists that I've worked with to be very, very concerned about doing work ethically and respecting people's values and not imposing our values on our clients. Yeah. So in terms of how I navigate it, a lot of it is they talk about informed consent in the mental health field. And sometimes it's just a form that you sign, but it should be a much more robust process. And that's where the client is really given the opportunity and encouraged to engage their agency to be able to reflect on what they're wanting from treatment and what the therapist is able to provide and what they're not. Yeah. And so for me, a lot of that is around my dual identities as a priest and a therapist. Coming to me as a psychologist is different than coming to pastoral counseling or coming to talk to your priest, and how we navigate that is a really important part of that informed consent process. So that's sort of how I navigate it. And like I said, I haven't really had the challenges that in some areas of the country seem to be having more challenges.
Yeah. Yeah. So that dual identity of psychologist and then, priest, spiritual director, spiritual leader, what are the differences between the two? How do you parse those out?
That's, the short answer is, I don't know, not to be flippant about it, but it's like, it is a mystery. Yeah, I taught a course at a local Catholic college last year on spiritual and psychological development. It's like, what does maturity look like spiritually and psychologically? And it was fascinating how much overlap there can be especially in terms of like the developing the complexity to be able to, okay, I have my convictions or at least, what I'm trying to adhere to and trying to understand more deeply. And then I encounter something very different. Mm-hmm. How do I respond? Do I need to categorize or defend my beliefs or can I encounter something different and be curious without being threatened? These are some of the markers of maturity. And those are qualities both of a good therapist and a good spiritual director. So there's certainly overlap. Now, there are as many different kinds of spiritual direction as there are forms of therapy, modalities of therapy. Some are more directive and some are more take the role of accompaniment. So kind of Ignatian style of direction would be different than a more active giving of direction. And so I would say simply that, spiritual direction tends to focus more on the relationship with God specifically. And then therapy, of course, especially when you're getting into diagnostic criteria and treatment for specific psychological needs, that's very proper to the role of therapy. So those are, there's very clear areas where there's distinctions. But then that middle area, there's a lot of overlap.
Yeah. One of the things that I'm really interested in, especially talking with LGBTQ people who've done therapy in kind of like a faith-based counseling setting, based on the way that they describe it, sometimes what they're talking about to me feels much more like spiritual direction than therapy. I've heard stories of Catholic Christian therapists being kind of like more directive, kind of pushing clients into positions that align with their religious views, and bringing prayer into therapy in a way where they'll do things. And I actually just spoke with someone who had this experience, where they'll do things like the therapist will pray with the client, and then the therapist will say, I think God is telling me this about your experience, or how you should understand your experience. And one of my concerns, because of the power dynamic, is that the client will see all of this as therapy. They'll think that this is all coming from therapeutic practices, experiences backed by professional training and licensure. And I worry about the ways in which it can overtake client autonomy and client value setting, but also potentially be manipulative towards clients. So I'd be, really curious to hear from you, like, if someone comes to you and they're trying to make sense of, what am I really receiving here? How do I parse out the therapeutic relationship and hold my therapist accountable to providing what I'm seeking here? How would you help them talk through that and work through those various pieces?
Yeah, I would definitely share the concerns that you're raising. I think when something is being introduced into the therapeutic relationship by the therapist, that it does hold. It is the power differential is really significant, and it does carry the weight of, okay, this is a licensed therapist with all of this training, and it must be arising from that, and that's where I'd be very, very cautious that, in the field there is an expectation that, and it's kind of become like almost a bit of a buzzword or whatever, and it loses its meaning, but, evidence-based treatment, that we have imperfect means, but means that we try to make sure that the treatment that we're providing is in research, it's supported by research and shown to be effective for the identified goal, the therapeutic goal that we're working towards. And so I think what I would say if somebody brought those concerns to me, what you just described, I would say, well, a client is very much in their rights to ask, what is this based on? Like what treatment modality are you drawing from in order to guide our work together? That's a very fair question to ask. And a good therapist should be able to answer that and say, okay, well, here's, the studies that I've read, and this is, the training that I have. And another really important thing is how does a therapist respond to critical feedback? If a client should be free to say, I was really upset by what happened last session. I found myself really, questioning what you shared with me. I was quite angry about it, and I really didn't like it. And a good therapist should be able to respond in a productive way to that, to, again, have that posture of curiosity, non-defensiveness, and be able to make productive use of such an interaction. So I think those are really important. They're not secondary components to therapy. They're really at the heart of it, that they're, because you're talking there about evidence-based treatment and the therapeutic alliance and the quality of the relationship between the therapist and the client. And unfortunately, there are some therapists that do bring in, I would say, inappropriately and without good evidence base, some of these, like bringing, especially if it's therapist introduced prayer, that's not part of the informed consent process. Like that is somewhat problematic, I would say, and unfortunately that does exist, so I really encourage, when people ask me for like a referral or I want to try counseling, who would you recommend? I will often say, it's much more important to have a good counselor, therapist, or psychologist, somebody who's very professional, very well trained, and you have a good rapport with, a good relationship, much more important than that they be Catholic or share, your value system. Because a good therapist will respect your values and won't impose their values on you, but also give you that freedom to explore. This is what I've been taught all my life, but I'm really wrestling with it. And okay, let's explore that.
Yeah, I think I've been really lucky to have had really good therapists and psychologists that I've seen. I think about one that I saw several years ago. She's not my current therapist, but I just shared with her where I was coming from, and she did disclose I just want you to know I'm Catholic. I do disagree with the church teaching in these areas, but you set the goals of therapy. And we just kind of talked about what that means. And I shared with her, well, I want to be celibate. And I know that my reasons for it, I think that we're not aligned with her values. And she was a little confused at first. Her initial question was wait, do you want to be asexual? Which, to me is kind of I do think therapists need more training in these areas. But, then we had a conversation about it. And she said essentially, okay, I understand what you want to do. This has been my experience of working with people who've had similar goals, but I will do the best I can with the tools that I have to help you achieve this. And I really respected that. Slightly different, but my current therapist, we were having a conversation at one point, and she just did some self-disclosure in ways that I don't think are inappropriate, but I think partly because I'm an attorney, I'm so sensitive to professional boundaries.
Yes.
And I think that what she did is probably fine with other clients, but I was kind of nope, don't like that. We need a reset. I need distance here. And she was very receptive to that feedback, and that kind of informed what our relationship looked like going forward. And I think that a lot of times people who go to therapy don't feel like they can have those kinds of conversations with their therapist, and I wish that they would. Yeah.
No, absolutely true. Sounds like a really, really good therapist who can respond to that, and that's great, right? Because it's a recognition of okay, this is something really important to you.
Yeah.
And that matters a great deal. And for therapists to be able to set aside, okay, maybe I would prefer it this way, but this isn't about me. I'm not the one setting the agenda, or I'm not the one, I forget who, I think it's Gabor Mate who says it's not the child's responsibility to manage the happiness of the parent.
Yeah.
And it's not the client's responsibility to make me feel good about myself or feel like I'm an effective therapist. That's backwards, completely backwards.
Yeah. Actually, it makes me think of another therapist that I saw. My current therapist, she went on maternity leave. So I saw another therapist who was a gay guy, and I knew he was partnered. And I was doing an initial consultation to see if it would work. And I just told him I want to hear how you would respond if I go in one of two directions. One is, I want to, be very sexually open and have a lot of different sexual experiences with a lot of different people. And the other side is I want to commit to a very traditional Christian sexual ethic. I want to not engage in practices like masturbation. I want to be celibate. Can you handle me wherever I want to be on that spectrum? And I loved his response. He said that, my role is to, again, create space for you to pursue your goals. And if that brings up things for me personally, that's for me to take to my own therapist. That's not for this relationship. And I so loved that response. And I did see him during that leave, and he was really helpful. But I think a lot of Catholics would be surprised that a gay, I'm assuming pretty liberal therapist, would be very open and respond in that way. But again, I think that's where, having the professional, ethical standards and things like informed consent and knowing roles and responsibilities and boundaries does a lot, I think, to protect religious clients going to therapy.
Absolutely. It's kind of the irony of sometimes this, narrative of persecution among professional organizations that you sometimes hear Catholic therapists saying, well, okay, I feel unwelcome in my professional association, a regulatory body or whatever. And it's well, actually these protections are for religious clients as much as for anyone else's value sets, and it matters a great deal. I am very concerned about people in the healing ministry, pseudo counseling space who are not licensed and who do not follow a professional code of ethics or have an avenue for complaints, an ethical complaint. That is for the protection of the most vulnerable, of the individual, the client, and they're really important.
Yeah, I mean, I think about a lot of these like ex-gay ministries in the past where they engaged in kind of like unlicensed pseudo therapeutic practices, and then the counselor ended up initiating sexual relationships with their clients. And what I tell people is like, do you know where those people have to go to initiate a complaint when that happens? Nowhere. There is no body that's going to hold them accountable for that. All that you have are lawsuits in the press, and both of those are extremely expensive for clients to pursue. And I worry a lot about like opportunities for abuse once you leave licensed professions. Yeah,
absolutely. Yeah, I think that's again, like, this is being able to stand before the complexity and hear all different perspectives and arguments is so important. Like the conversation around conversion therapy. I really appreciated your piece, reflecting upon the bishop's conference decision to submit an amicus brief in support of overturning the ban on conversion therapy in Colorado. It's complicated, and one of the things that is often overlooked is that, as you say, much of these sexual orientation change efforts or conversion therapy, much of that occurred outside of like formal psychotherapeutic environments. And so, one could ask, okay, and I think that is part of the argument, is, the state is intruding upon the therapeutic space. And there's a whole lot that could be said about that, but the reality is a lot of this is happening outside of the formal therapeutic settings. And, the church has a long history of needing secular authorities, whether that's the media or elsewhere, really benefiting from scrutiny by these organizations. I mean, the sexual abuse crisis is a extraordinary example of that, and very painful one, where it's like the church was not responding well and appropriately in lots of places, and as a result of the media coverage is doing a much better job. Of course, there's always more to do. I think also here in Canada of the residential school history here, and a few years ago there was that article about the discovery of potential graves at a residential school, potential graves of children, and the kind of media storm that followed caused a real reckoning for the church in Canada. It's been extremely painful, but I believe, as a psychologist and just generally, that it is better that these things be brought to light, and better that they be talked about. And sometimes these there's a Freudian slip, secular organizations provide that avenue for us.
Yeah, it actually brings me to something that you had mentioned at the start of our conversation, which is, part of what we need to be able to do as people is look at ourselves in the mirror and be able to take an accounting for our histories, for the various parts of ourselves, and be able to look at them lovingly, right? And to kind of work through any shame that we might have around it. And I think about this as the church too, I think part of taking accountability as an institution, part of acting as Christian moral agents, is being able to look honestly at our history, take an accounting of it, and integrate it into our understanding of ourselves and what our responsibilities are moving forward. And too often we try to delay that until someone forces us to, and then it literally bankrupts us. And part of what I hope from the church is that we'll go through this process more quickly and maybe won't need to get bankrupted in order to do it. Yeah.
That's a great point. Yeah.
Yeah.
Yeah, no, it's true. It is a very hard thing to do,
Yeah.
to look at ourselves honestly and yeah, make an accounting and see the beauty and the brokenness.
Yeah.
Be able to see what happened to us and what we did.
Yeah.
And see it all and be able to stand before it and recognize that shame has no place here. It's not, shame is not of God. That's not his voice. That all of this is part of our journey and part of his walking with us. And he's there for all chapters of it. And so the more we can kind of stand in that space to see ourselves and accept ourselves, and then come to believe that maybe, just maybe, that's how God looks at me as well.
Yeah.
The more we can do that, the healthier and holier, I think, we can be.
Yeah. Yeah. So we're coming up on time, but I want to ask one more question, which is in my experience, I don't know if this is your experience as well. But working in these spaces can be really hard. I think it can be really easy to get demoralized. It can get really easy to be caustic. It can get really easy to, feed into and partake in what I think are like the unhelpful framing of the culture wars. For you, what helps you to stay hopeful, thoughtful, and moving forward in a way that you think is productive when engaging in this work and seeing all of this?
Boy, that's a probing question with many layers. Very good. I love that. I think, for anyone who's done work on like family of origin and kind of tried to sort of grow and heal from early childhood experiences or just life, it can sometimes feel exhausting. People often will use the phrase like, I'm tired of being the only adult in the room. And I heard somebody respond to that very, there's a way I guess you could think of it as being dismissive, but they respond and just say, well, like, but thank God. Thank God that you've come to this place. Yeah. And I know I've referenced it a few times, but I really enjoy teaching this course on spiritual development and spiritual and psychological development and maturity, because it's really provoked a lot of reflection for me. And all of these theories about development and maturity, all of them say maturity is exceedingly rare. Like people who come to the higher levels of psychological and spiritual maturity are a very small subsection of the population. Yeah. And that's why it's such a treasure when you do find a good spiritual mentor or a good kind of well-balanced therapist, because they're not easy to find. And so to whatever degree God has invited me on a path of my own personal development and maturity, like, thank God. I do feel very grateful. As hard as it's been to sort of navigate the space of psychology and faith and working as a priest and a psychologist in the church, it's also like thank God, like what a gift. So that has been for me a great source of consolation is just gratitude for what I've received and what's been given to me. And then, it is not good for man to be alone. And so I think another source of strength and, this current project that you're working on, our mutual friend Simon as well, like I'm so encouraged by finding, others who are navigating similar waters or, just kind of just trying to be mature in the midst of the messiness of life. And I think there's a real support that comes from finding those voices and friendships and companions along the way. And so that does help, but also, the discouragement is real, and that's something that a lot of people face, and even the response of anger or cynicism. Like, I understand. That makes sense. And I just would say, you're not alone. And those voices are not the final voice. Your voice matters too.
I think that's a great place to end. Just like holding these things together. Simon and I were talking a couple of days ago about, like where all this stuff has brought us. And on the one hand, I do hold on to like the pain and the anger in these stories and all the suffering and the deaths of people like Alana Chen, alongside the fact that, with all of the pain, this work has also like facilitated such like wonderful friendships and conversations and connections, and I do really think it's possible to like hold both like the pain, but then also just the deep pain, but also just the deep gratitude that I have coming out of these spaces. Very well said. Well, thank you so much for taking the time. We're at time, so I think I'll wrap us up there, but
Sure.
Thank you for all the work that you do, and I'm sure that the conversation will continue.
Likewise. Thank you, Chris. Ever grateful.
Yeah.